afternoon. Welcome to Green Oaks Expert Talks. So just to start with a brief introduction about Green Oak. So Green Oak Initiative is a community mental health center based out of Bangalore, which has been co-founded by Dr. Shlesha Bagadia and Dr. Soumya Krishna. It's a collective of mental health professionals, which entails psychiatrists, clinical psychologists, and counselors. And we provide services for young adults and geriatric clients. Some of our initiatives include low-fee clinic, where we provide our services to low-income group. And we do have a specialized perinatal services called Chiguru. So these are some of the initiatives by the Green Oak Initiative. Welcome all. In today's Green Oaks Experts Talk, we have the well-renowned obstetrician and gynecologist, Dr. Shaibya Saldanha. She's a practicing obstetrician and gynecologist and has been practicing in Bangalore since almost past 30 years. She strives to bring in gender affirmative practices and human rights perspectives to her clinical work. She had co-founded Enfold in 2002 to address life skills approach to sexuality and personal safety education. Enfold also works in rehabilitation and support of survivors of sexual violence and domestic violence. At present, she's working as a consultant in health department in Meghalaya to improve rural maternal and child health indicators. So welcome, Dr. Shaibya. It's a pleasure to host you and to have you between us to share your expertise. So she will be talking today and sharing her expertise in hormone and mental health. And she'll be talking about, like, let's say for 40-45 minutes. And after that, we will open it for discussion. In case if you have any questions, anything that you would like to ask, feel free to put it in the chat box. And I'll be happy to facilitate that. There are some questions that we have received via email. I'll be taking it up once Dr. Shaibya finishes a talk, and some of the questions are going to be covered during the conversation as well. So yeah, over to you, Dr. Shaibya. You're on mute.
Thank you all, and lovely. I will meet all of you as we talk. I don't want this to be very boring. I'm going to just give you a general outline of how the hormones go up and down in a normal person or a normative person, and we'll work. Now, I want to also, before I start, be very clear that while men's hormones and women's hormones have been studied to great detail, I think the new spaces where we are talking about gender fluidity, various modes of sexualities, sexual orientation, gender identities, I do believe that hormones are not normative, but not necessarily for everybody. Okay, so I really would like that to be clear in the beginning. And now, which I'm talking about today, what I'm talking about the hormones in a woman's life, we are talking of a cishet woman, because that's what we normally study, right? So I don't want to say this is what is there for everybody. So cishet women have been studied. So this is their hormone processes which are going on. And I'm sure we would look at different types, because when we look at the fact that by the 6 weeks of when you are in the intrauterine life, right? 6 weeks is when the XX, XY plus the XXY, X0, there are so many different combinations, mosaic patterns which can arise. Start deciding how your gonads are going to act. And as you all know, our gonads are ovotestes. That means they are an ovary and a testes together. And it's whether there is a Y chromosome that is there or the X chromosome that sort of determines whether it becomes an ovary or a testes. And so the ovary where the eggs grow are the outside, and in the inside there are the old testicular tissue which secretes androgens and male hormones, testosterone. And similarly in a male, the testes would have in the center, which is where the seminiferous tubules are, where all the sperms grow. On the outside is the ovarian tissue, which is there, which also secretes estrogen in a man. Now, once a baby is born, the baby is quite what one would call as not reproductively in any way stimulated, nascent, or asleep. And so the child is just a survival animal for a few years. And then they do say that the gender of the child starts getting expressed by the time children are 2 or 3. Earlier, we would say 11, 12, 13 is when you express your gender. Then we started saying 5 and 6. But now we know that even by 2 years, 1.5, 2, 3 years, a child does express the gender that they feel they are. Their gender identity starts getting expressed. By the age of 5, 6, 7 in women, the ovaries start the process of functioning, and that basically your reproductive system is the one which is needed for your adulthood. So it starts by this age and starts secreting hormones, so your estrogen body, and some level of testosterone also. By about 9, 10, 11, by 5, 6, when the hormones start, the growth hormone is also kicking in. So the growth spurts start, the development from a child into an adult starts there, height mainly, body fat changes. And then by about 10, 11, 12, and now girls are starting their periods earlier, this would also come in. So the breast development, slowly all these things start off. Now the uterus having periods only will happen when the eggs are getting produced. So that's the last point. Your body should be pretty sorted out by the time the eggs are getting ready to be impregnated and attached to the uterus. So your breast development, so the height increases 4 years before the periods are going to start. The body hair, the secondary sexual characteristics start off 2 years, 3 years, pubic hair. So sometimes I have women who say, my daughter's 7, she started having pubic hair or underarm hair, and there's anxiety, but that is another 3 to 4 years. So 10 and a half, 11 for her periods to start is not a problem. We don't consider it precocious. As these hormones start coming in the beginning, it brings about more mental alertness, clarity. There's a certain amount of sexual exploration, curiosity, looking into each other's underwear and things like that. This time of curiosity is also the time when 5 to 11 years old also get caught by predators, sexual abusers, because there is a curiosity and an understanding of shyness and discomfort, which may start. By 11, 12, 10 to some people, the body starts growing, the breasts have already developed, and the hormones, estrogen particularly, has come into the body. This time, normally the child is more active, more agile, moving around, and then the progesterone comes in. Now, the progesterone is the one which has a large amount of the hormonal fluctuations which start. So the hormones will go up, the progesterone. So the main difference between a biologically female and a biologically male person is that the males have androgens which rise, and though there are cyclical changes, even circadian, like in the day, the estrogen, androgens go up and down. The main huge cycle that women go through is primarily because of the ovulation. So this woman will start having sudden rise in the progesterone, which goes up, and then it rises to a level because she's ovulating, and then it comes down. And these are going to be, and I'm going to discuss what are the changes which occur. Where your first thing was survival of the individual, and the second was survival of the society. The survival of the species depends on your ability to reproduce. And so the reproduction is going to be now what is wanted, right? So the body starts changing and wants to collect it. So I often tell people that the most times we are very sleepy is when the body is growing a lot. So the first time is as a baby. So the baby's growth is enormous. From the age of 0 at birth till about 3 to 4 years, the baby's body changes from a completely helpless, small 2.5, 3.5 kg baby into a 6, 7, 8, 10 kg baby, a child who's walking, moving, talking. There's so much development in the first 3 years. And so children sleep a lot. They need to sleep a lot. So even sleeping by 8 o'clock and getting up by 8 o'clock is really good for babies. And babies, those of you who have kids or who have siblings you've seen, you know that babies would sleep almost 16 to 18 hours a day. And that is essential for all the growth systems to go. Second time that we feel very sleepy is the teenage time, because that's when your body is growing and changing. The third time is when a woman becomes pregnant, from shifting from a non-pregnant to a pregnant body. So the first 2-3 months, she is so sleepy. She gets up after 12 hours of sleep and she's like, can I sleep some more? I just want to sleep some more. And the fourth time that women need a lot of sleep is during menopause, when they need the normal 6 hours or 5 hours, which a lot of working women with families use to maintain themselves, does not work. And we'll come to that later. So the biggest problem of the teenagers, and so many people are being diagnosed as PCOS, is because at this time, from somewhere between 12 and 18, when your body is becoming from a child to an adult, you need a lot of sleep, sometimes 9-10 hours. You need really regular meals and a lot of healthy food, a lot of proteins, egg, meat, fish, grams, lentils, curds. You need a lot of these proteins at healthy, correct times. And you need a lot of physical exercise, because your bones and joints are all growing enormously. And the strength that you get by the age of 20 is what lasts you the rest of your life. Taking calcium after 40 has no meaning. And what do we do to our education system? So this is why our mothers and grandmothers and great-grandmothers had perfect periods which started at 14, 15, 16. They said, I've never had a problem with my periods. My periods are perfect. And then one day they stopped. And they look at you and say, why are periods not coming properly? What is wrong with you? And this is what is wrong with us. And I consider that the education system we have is one of the biggest criminals for what I call a temporary or an education system created PCOS. Because we expect our children to get up at 5:36 in the morning, rush off to school. At 7 in the morning, nobody's hungry, so they don't get to eat very much. They leave on a hungry stomach. A lot of the snacks which are given are not often fruit or salads or proteins, like an egg and things like that. It's, lighter food, very high in carbs, like idli or dosa or bread or sandwiches. They eat a lunch which is often carb rich because you want the kids to eat something light. Sometimes they don't eat it. Then they come home and then you have classes and exams and studies and homework. So they don't sleep till 10:30, 11 at night. And because of this, the fact that we have damaged the sleep system of young people, prevented physical activity. I know so many of my friends' kids who just were stopped. Bharatnatyam dancers, salsa dancers, hockey players, everything just stops when you're in class 8, 9, 10. Just stop. Your activity has to stop because you have tuition and you have this and you have that. And the middle of the education system, from class 8 to class 12, almost all your physical activity stops. We women stopped walking to school now because distances and safety issues have come up. So everybody travels by vehicle. And sitting constantly all the time, sitting in school, sitting in vans, sitting at the home. So what I'm finding is this lot of young people who are getting what is called PCOS. So your periods become irregular instead of your beautiful cyclical cycle. You have periods which are very regular. And with all this also, the body becomes very tired. Your child is cranky, upset, gets very, very sensitive, angry. All these things arise because your hormones are confused. They're not getting the right food, the right sleep, and the right physical activity to be able to develop well. So I have so many patients who have come to me who have been given oral contraceptive pills or hormonal tablets because their periods are coming, once in 6 months or 3 months or twice in a month, and the parents panic. And this I have to mention here, which is very sad, is that all women are as useful as their uteruses. So people only worry about the uterus, nothing very else. So when they feel that the uterus isn't functioning, so the mothers and grandmothers come running because the periods are irregular. They don't really look at all the other health systems, that you should let the child go for walks with their friends, play games, do anything which is physical activity. So this is the damage done to a beautifully systematic hormone takeover of the body, which would have otherwise come. So that by 1820, the body is formed. But we do know that the brain changes which occur for adulthood only get completed, the wirings and all, and the prefrontal cortex, which is your emotional basis, only completes by 20 to 24 years of age. So therefore, and just, yesterday I was reading on the thing that the number of suicides in young people has gone up by almost 26%. And you can imagine how these health being poor, your physical health being poor, definitely affects the mind. And so young teenagers have more risk of depression. And now, as I said, that we cannot really separate our the social lens with which a woman is often watched from her mental health and her physical health. So I'll just give you an example. There was this 27-year-old woman who came to my operation, OD, and she walked in and she sat down and I said, yes. And she looked quite fit, average build. And she said, is it possible to remove my uterus? And I was like, I'm sorry, why would you want to remove your uterus? And she says, because I cannot take the moods. So I said, what do you mean? So she said, my parents, my father works in a bank, my mother works in, I think she was a teacher. And they're very caring parents, very normal. And I have a younger brother who's 24. And since the last 4 years, for 1 week before my periods, I have become a horrible person. I come home, I'm angry, I'm irritated. Little things will cause a flare up. At work, I'm perfect. At my college, I'm perfect. But when I come home, I'm this horrible human being. And sometimes, as I speak to my parents or to my brother, I'm so literally tear them apart. I say horrible things to them. And it's I can see their faces looking at me in shock and upset, and I cannot stop the words coming out of my mouth. And then, I go to my room and I don't want to eat, and I take my food into my room and I eat it, and I just get up and go to work because I have to, and I'm so angry and upset. And then my periods come, and I'm a different person the next day. I'm relaxed, I'm comfortable, I'm a happy person. And in the beginning, I realized it took me a couple of months to realize it was my periods causing this. And, doctor, what you call premenstrual syndrome. But when I would come home, I would apologize to my parents. I'm sorry, I didn't mean what I said. I tell my brother, I'm sorry. But how long can I keep saying sorry, sorry, sorry? The words are spoken, and words once spoken cannot be taken back. So, doctor, I wanted to know, is there some way that I can shut down my uterus or take it out or something? So I said, okay, why don't let's discuss what's happening. So I asked about her family and what she studied. So she had finished her master's. She had done her MSc, completed it about 2 years ago. And then she was working in a laboratory, and she also wanted to do her PhD. She had got options in 2-3 colleges to go for her PhD, but she was 27. And her parents said, if you go for your PhD now, it's another 5-6 years. You'll be 33. You might have difficulty getting married. Why don't you get married and then do your PhD? I mean, whoever we get and all that, let's find a good suitor for you. But whoever it is, we'll tell them that you would like to do your PhD and all. And she said, well, you can look for somebody, but I want to do my past PhD. I said, what about your brother? She said, oh, he's doing his MBA now, and then he wants to go abroad for further studies. He wants to do finance and international finance. So I said, but what about him going abroad? She says, oh, my parents say it's fine. And then slowly, as I spoke to her, we realized that one of her basic anger was the gender discrimination. That for her brother, going abroad to study was never going to be an issue because he would get married. And in fact, the further he studied abroad or whatever, his marriage price in the marriage market would go up. Whereas for her, the marriage became more important. And what we realized over a piece of process as we discussed it in more detail, was there was a deep-seated anger against her parents who were very loving, caring, but terribly patriarchal. So anyway, I spoke to her. So this is one of the things I would like to talk about, what we call premenstrual syndrome or premenstrual symptoms. It was always, this disrespectful way of saying that time of the month. Now, why that happens is very clear. In the beginning, when you have your periods, your body is fresh and it's like, oh, okay, no baby happened this time. We need to have a baby. So the egg starts growing. And when the egg starts growing and the egg's getting ready in your body is like, hey, I need to be nice and beautiful and pretty to attract this sperm. So you are happy, you're energetic, you're smiling, you have so much energy, you feel light. And then you go ahead with your stuff and you're like really, enjoying life. And it goes on like this till you ovulate. And then the egg comes out. Now, when the egg comes out, it lasts for 24 hours. And at that time, you have a sudden dip because when the egg comes out, the body presumes that there's a possibility that the sperm may come in. And if the sperm comes, the sperm is a foreign body, just like a virus or a bacteria. And the automatic reaction of my body is whack it, beat it up. You can't beat up the sperm, right? So all the immunity is brought down. So 1 or 2 days before your ovulation is going to happen, your body immunity comes down. And so some of you will find that in the middle of your cycle, just the day before you get your ovulation pain, you feel a little tired, a little viral, feverish, a little exhausted. And you wonder, oh, am I coming down with a virus? Because your immunity has come down. And especially if you live in Bangalore or any place which is like infested with viruses, there's always some virus wanting to run in. So you feel a little scratchiness in the throat, tickling in the nose. And then the ovulation gets over, the egg has come out, and within 24 hours, egg is either dissolved or got pregnant. And the immunity comes back to normal because now we don't want any more sperm coming in. So you come back to normal. You say, oh, I was feeling a little feverish, but it's gone. This is a big issue for a lot of couples who are trying to become pregnant because the day of ovulation, when all the doctors are saying, go have sex, is a time when you feel very sick, very irritated, very feverish, and not at all in the mood to have sex. It's like, okay, take one crocin and have sex. Very boring. So that happens. Then after 24 hours, they settle down, body settles down, and now you're going into the progesterone phase. So in the beginning, it was estrogen mainly, and now progesterone starts from the egg. Progesterone is pro-pregnancy. Now, the body doesn't know whether you're pregnant or not because the egg came out. If the egg had not been fertilized, it would have just dissolved. If the egg had got fertilized, there is an embryo floating along the tube coming to come and sit inside the uterus. So 7 or 8 days, the body is not very sure. So the body says, I don't know. Okay, just continue your life normally. Now, by about 4 or 5 days before your periods, your body is like, okay, if I'm pregnant, this baby is going to come and sit inside the uterus right now. I am not pregnant or pregnant, I'm not very sure. But since the whole intention of an adult life is to reproduce little human beings, the body says, I'd rather presume that I'm pregnant till I get a definite signal that I'm not. Can you hear me clearly? Because I'm getting an internet thing. You're okay? Can you hear me?
Yes, we can, but there are times in between when it fluctuates, but we are able to.
Okay.
Yeah.
Okay. All right. Just let me know. If I fade out anyone, just raise your thumb, then I will cut off the video. That might help.
Sure.
Okay? Anyway, then you come to the last 4 days of the period time, presumed period cycle, and the body says, now you're going to be settling inside. Take care of yourself. So rest. So your body starts feeling very tired. So you feel sleepy and you feel tired. Again, this foreign body, because the sperm and the egg has formed a new human being, which is alien to the body of the woman. So there is going to be an immune reaction when it digs into the uterus. So the immunity comes down. And so when the immunity comes down for the second time in your cycle, you can pick up a cough or a cold or a fever or a virus again. So that happens. So you feel tired, you feel a little dull, you feel not very happy, don't feel like getting up in the morning, don't want to go for your exercise because your body's saying, hey, take it easy. And now comes the social dichotomy where, as a woman, you're always told, take care of everybody else, don't look after yourself. Everybody has to be taken care of first, then you. And your body saying, take care of yourself first. And for a lot of people, it becomes very difficult because if they're living with family, there is certain expectations from women. Even at office, there are expectations that you're taking care of people and your body doesn't want to. So in the middle of take care of everybody, don't take care of everybody, take care of everybody, take care of yourself. Boom. What happens? You get upset, you get angry, you get irritable, you feel frustrated, and all the things that we call PMS happens. PMS is the first time you actually acknowledge your naked emotions. And I often tell people, tell me what makes you most angry. Like for this woman, what made her most angry was her parents stopping her from going for her PhD, even though she was a great candidate, just because they wanted her to get married. Whereas a brother would never have any of these restrictions at all. That was a core reason. And it was against society in general and her parents in particular. And her poor brother was a target, though he per se was as much a victim of the system as she was. And so, suppose, what is it that makes you angry? Is it your parents going on telling you things? Is it about, your spouse or your partner uh, not liking the food you cook, or not liking the way you keep your room, the way you do things? And other times you're okay to have it, but at this time it drives you nuts. Or if your partner is a person who's messy or makes food a different way from yours, doesn't seem to care about your needs, again, you become very, very expressive and very, very angry about it. So these are the things which work. So this is what people call premenstrual syndrome. And I say that this is a time when you are actually coming in touch with what is actually irritating you in your life. Now, what are the different things in a young teenager who's growing? What are the different things which can cause stress, particularly at the time of premenstrual time? So there is first gender identity. So the person is like, who am I? Am I a woman? Am I a man? Am I neither? Am I both? Confusion because it's not normative. Orientation, your attractions to people, a lot of sexual confusion. And now because most kids by 10, 11, 12 have seen some amount of pornography, definitely have seen sexual imagery on TV, in normal movies, which are seen by the family. That stimulation has started occurring. So there are questions, and these are not answered by parents or by schools. So that creates a sexual confusion. Body image, a huge issue. Every video, every movie we see are of these flawless human beings, fair, no hair, no pimples, no acne, flowing hair. Body is like in the perfect, what would call a perfect body of 36, 24, 36, or maybe stick-like figures. Huge onslaught of completely abnormal, illusionary bodies. Then there's stress from parents, stress from family, a lot of bullying. All these things compound to create a teenager's risk of going into depression, partly because of the hormones, partly because of this growing up that your hormones are building up inside you. And the question that, am I really good looking? Would I be somebody's partner? Would somebody like me? Is such a big question for the young people. And so, an aunt or uncle who comes and says, oh, you're so dark, oh, you're so skinny, oh, why are you so fat? And so many mothers I know who are on the bigger side are so deeply distressed because they're like, my daughter's so skinny, doctor, my son is so skinny. And everybody says, are you eating up all your child's food? This body shaming is like incredible, and that has a huge impact on women's health. So these are the basic issues which come up, right? Any questions so far?
Any questions from the group, like whatever Dr. Shoaiba has covered till now? Dr. Rema, do you have any questions?
See, any gender-based counseling. So I have seen many places now people are having issues with transgenders, or they're getting married. It is allowed now. And recently in Kerala also one couple, one person died, a trans man died. So I am thinking of, I don't know whether it is connected to the matter we are discussing, but anywhere the specialization for counseling based on gender is available in Bangalore. I was looking for that.
Bangalore, I don't know if Green Oak is doing it, but there is an organization in Bombay which is doing a fantastic job. I've forgotten the name. It's with M. Does anyone know that? Mariwala. Mariwala Initiative is doing fantastic counseling, gender, uh, understanding of gender for counselors and even for doctors or anybody, teachers. I think everybody should know about it, parents. So there is an understanding of what does gender mean now in the present state. The concept of transsexuality, identities, orientation is coming up. Yes.
And couple need counseling, and I heard many cases like that. No, one of the couple had some gender issue, and the other wife doesn't know what to do. So, and the counselor also, we are not getting a proper counselor to counsel, because after 5 years of marriage, the wife happened to know that husband has a sexuality different, and they have a child also, I think. So that kind of issues, some expert, and no, it will be helpful. Like that.
Yes, it's definitely important for the counselor, the psychotherapist to have good knowledge and an understanding of how gender-based counseling has to be done, because this is very important. And part of the reason is that we don't have sexuality education in schools. We are not allowed to talk about different genders, transgender, homosexuality, heterosexuality, bisexuality in schools. So these young people who grow up are forced into marriage, and very often if the person says, I don't want to get married, or they show a different orientation and the family picks it up, the whole thing is, oh, they're sexually frustrated, get them married, they'll be fine. And this is a deep, insult or injury to the person and also to the partner, the innocent partner who got married to what they presumed was a cishet human being. And then when the person turns out to be transsexual, there are a lot of issues which come up. So I think that is an issue. In fact, I know couples where one or the other has not been able to have sex at all because, there was one case where this girl knew she was homosexual, didn't know how to tell her family. She started her BA, finished her BSc, finished that, and then the parents wanted her to get married. She was 24. She said, no, let me do my, this thing, what do you call it? Let me do my master's. It was just a way of pushing away the marriage. Finished her master's, became 26, came from a small town. So parents said, you have to get married. She said, no, I want to go and, study abroad, or I want to work somewhere else. And the parents went into a tizzy. They said, no, you have to get married. If you don't, and then, the classical mother is like, I have a heart problem, father has some blood pressure has gone up because of you, and I'll commit suicide. What will the family say? So the girl got married. Fortunately or unfortunately, she had a very sort of a considerate partner, and she told him, I don't want to have sex immediately because we don't know each other. And he said, yeah, sure, I understand. And they continued that for some time, maybe for 3-4 months. And then, even he started questioning, like, when will we get intimate? And she said, not yet, not yet. And then they started having fights. So she went back to her parents' home. And that's when, he spoke to his mother. And you know how this goes? There's no conversation between the couple. He spoke to his mother, who spoke to her sister, who spoke to an aunt who knew the girl's mother. And that conversation came around like this. And the girl's family realized she was not having sex. So then again, it was a family drama, and they forced her to come back again. She came back and she said, no, I'm sorry, I just cannot do this. And she left. And finally, they ended up with a divorce. But, like, that boy was an innocent divorcee, he was, collateral damage from this force by her family. And her family really treated her very badly. Finally, she left home and she went to a different city to start working. But this is because this conversation does not happen, that young people who's confused about gender, about their sexuality, are forced into marriage. Sometimes they themselves not understanding it think, then when I get married, things will become okay. To continue, I'm just looking at some of the questions.
Yes. So Supriya has a couple of questions. So Supriya, would you like to ask,
Yes.
Yes, Supriya. Supriya, are you there? I think she's struggling with her network. So I'll just.
So she's writing it on the side.
Very interesting talk till now. Yeah. Look at the process. But what? Can you hear me?
Supriya,
Hello, can you hear me?
your network is fluctuating.
Yeah.
So
Can you hear me now?
Yes.
I'm going to switch off the video.
Sure.
Can you hear me now?
Yes.
Yeah. I'm full.
Yes.
Yes, I'm
So I think, I'm not sure Supriya is still with us or not. So till the time Supriya,
I'll continue.
Yeah. So I just have
there
a
are two questions
question.
on the side. They had
Yeah.
already written. Shall I read it out? It said that noticed girls age 7 or 8 getting too conscious about looks and makeup. How do you help such girls understand? Now, the worst thing we can tell children is don't be bothered about makeup. Don't be bothered about this, because the moment you say don't be, they promptly do that. Or you say this is not the age to worry about your beauty. Well, they are. So for them, that age is it. And that is where the importance of building beyond body image, or body image as physical fitness, playing with friends, drawing, color, dance. There are so many other things which can give a sense of achievement to a child, whether music, dance, art. So these are things which make a difference, So it's very important that instead of pulling children down, and I do see girls of even 12, 13 wearing lipstick. And here I'd like to blame the parents a little bit. That's my favorite, pastime. Is that when the children are small, 4, 5, 6, I take my 4-year-old boy and girl to school, to a shop. And for the daughter, I'll be like, oh, I want something really pretty. I want her to look like a fairy, fluffy dresses, frilly dresses, bangles, little clips, and, so many things to dress her up, lovely, pretty shoes, even heels. And for the boy, I'll be like, give him something dark and little tough, because, he's going to kick all the stones and he's going to do this, climb trees and all the rest of it. Give him some tough clothes. From the age of 3, 4, 5, we already put into children the idea that looks is important for girls and toughness is important for boys. And these are issues which come up. Just the fact that girls have to wear skirts to school, so they are immediately restricted in terms of movement, and boys can wear shorts. All these things make a difference. So, somewhere I think a unisex dress, which is very comfortable, where you can jump and move and not have to worry about showing your chaddis, is so important to help girls understand that their bodies are also important in fitness. And so I think that would be an answer for that.
Right. So, Dr. Shaibya, there was a question regarding PMDD in via email as well. And I think I also face a similar issue when I'm dealing with clients who are anyway emotionally dysregulated, but that dysregulation goes really intense during their premenstrual time. And it gets too difficult that it's difficult for them to engage also in the session. So I was wondering that how a collaboration with a gynecologist can be helpful. Are there any medications or something how do you deal with that?
Unfortunately, in gynecology, the only thing we do is hit it with you hit a little mosquito with a hammer, because we immediately start putting people on oral contraceptive pills. And while PMDD, when you give oral contraceptive pills to a patient, what happens is it's an estrogen progesterone tablet. So instead of having your estrogen and progesterone bouncing like this, you take the tablets and it gives you a steady state estrogen progesterone, then it stops and you get your periods because it drops and then it comes back again. So it's a much lower level of estrogen progesterone at a steady state in the body. And that is how oral contraceptive pills or cyclical hormones help in PMDD.
Right.
But again, as I had mentioned earlier, the issue is how do we break down that issue of what is happening? So there is where we have to look at the fact that, is this person suffering from depression or personality disorder? There is something underlying, and the PMDD is just bring it up because at that time the hormones also take away the block on the emotions. So your treatment should be for the depression, for the psychological issues you feel, without just blaming it on the periods. I would say the hormone up and down of the periods is just bringing it up. And this is also important in antenatal and postnatal health, because on an average, when I have seen women who have antenatal or postnatal depression or any other mental health issues, they often are correlated with something which happened. And they will say, yeah, in college I was depressed, or I used to get angry. I've tried self-harm. I thought of suicide a lot in between. So all these things are indicators. So these things will happen. So PMDD, I look at it as a mental health issue which is brought out into the open by the premenstrual time. So if the person is in a lot of stress because of it, oral contraceptive pills help in giving you the steady state hormones so that you can regularize your things. But until you sort out what are the issues behind it, it's going to be a problem. And there are some who would require antidepressants or medication, SSRIs. They find that SSRIs do work well in PMDD. But again, the psychotherapy has to continue. It's not just the therapeutic medication, unless the psychotherapy unwraps the issues, whether it's about gender, all these things do come up.
Right. Right. That was pretty helpful. I think we'll just take Supriya's question and we can move forward, right? So Supriya says that, so does dip in immunity equals to probably physical fatigue leading to mental health fatigue? And is it equal to cannot tolerate irritating factors that could be tolerated earlier? So I think you just covered partial of it. So anything more you would like to add on to?
Definitely that the physical fatigue is something that we should accept, that it's there. Physical fatigue is part of that time, but it's not fatigue. It's actually the body putting a switch in your brain saying you're tired, go to sleep. Because I want to take care of that little baby inside. So you don't move around, you don't jump around. So I'm forced to sleep. And that's why the day after your period, you feel so energetic and so, fit and fine. The other thing is progesterone also causes a lot of water retention. So you tend to feel very bloated. Your hands and feet are swollen. And where for us, any size increase is an immediate damage to your body image, that again becomes an issue. Like, oh my God, my pants don't fit, or my shirt is tight. Things like that immediately trigger off another set of emotions of, shame or not looking good enough.
Right. Thank you, Dr. Shaibya. So can we move forward and then we can take the next set of questions?
So now I want to go on to the next part, which is in pregnancy, because that will sort of talk to you about what are the things in pregnancy which become an effect. Now, I just wanted to mention that if you look at how even this little bit of progesterone during the cycle is affecting us, imagine this progesterone going 1,000 times that during pregnancy. So you can imagine how much more, again, the progesterone telling you, look after yourself, eat well, take rest, don't worry about other people. And your whole mental scheme, and especially if you're pregnant, you are possibly most likely married, especially if you're in India. So then you have all these household responsibilities towards parents, in-laws, husband, the presumption that you have to make your house, perfect, and you have to be this perfect housewife, this, goddess of the kitchen. So these are things which affect a lot. So the pregnancy issues come in. Now in pregnancy, so what happens is, first of all, I would say that any woman who is feeling depressed in pregnancy has probably had a history of it in school and college, and a careful history will detect that there were symptoms which were suggestive of depression earlier, before the pregnancy. The simplest thing which happens during pregnancy and the hormones grow is that a woman starts feeling very overwhelmed. And she gets angry easily because it's a physical fatigue also, as mentioned for the premenstrual. The physical fatigue causes a mental fatigue, easy irritation. So they feel angry, cry easily, get tired. And then there are all the anxieties. Will the baby be healthy? If there is a pressure in the house to have, like the husband may just casually say, I hope we have a daughter. And then there's a tension. Suppose it's a boy. Or in families which are more traditional, it has to be a boy. So that stress comes in. Suppose it's not a boy, what will happen? Then nowadays, furthermore, has become this anxiety about labor pains. How will I bear the labor pains? And since Normal delivery is the epitome of womanhood, and any cesarean is like, a dhabba on you, that, you have failed the mark. Again, the stress, suppose I can't bear the labor pains, how will I bear it? Suppose I have a cesarean, what will happen to me? Will I become ugly? As so many people, women get, marks during pregnancy, stretch marks. There's so much anxiety. Like I had this lady who came and in the 5th month, and her husband had come back from Singapore. And for $125, he bought a tiny box of something called No Mark, some sort of pregnancy care, skincare thing. And she said, my husband's got me this. I wanted to check with you. Is it okay if I put it on my tummy and my thighs? And I said, you can put whatever you want, but if you're going to get stretch marks, you're going to get stretch marks. Nothing in the world is going to reduce it. The only thing we do advise is oil, any oil, coconut oil, mustard oil, olive oil, it doesn't matter, to make the skin supple so that it doesn't feel itchy and scratchy when it has the cuts. But stretch marks are normal for pregnancy. But again, the pressure that you should become pregnant, have a baby, and then come back to your previous pregnancy, pre-pregnancy figure and your pre-pregnancy looks, it's enormously stressful. Then the next pressure is about going back to work. For a lot of women who are working during pregnancy, will I be able to go? And now that it's more difficult, a lot of parents are not around to take care of the young ones. Getting daycare, home care, or creches are not easy. So then that anxiety, how will I go back to work? Post-delivery, will I get leave? How will I take care of my baby? And again, getting torn between your aims and career goals and the stigma of being a bad mother. So can you imagine all this stress along with the high progesterone is just is asking for trouble. So when women go through this, so very often what I found is when women talk, I often ask the husband to come and I explain to him. I said, there's one couple who had come and I said, how are you doing? And she's looking very tired. So I said, are you sleeping well? She said, no, I haven't been sleeping very well. And the husband looked at her with a little worry and then he didn't say anything. So I said, are you getting angry very easily? Are you crying very easily? And she said, yes. And the husband was like, yes. So I said, oh, I can understand that. But, are you having nightmares? And she said, yes. I said, what are the nightmares about? And she said, not nice things. So I said, is it that you're running in the dark and you're going to fall off a hill? She said, yeah. I said, especially for the first pregnancy, it's like a complete unknown. And the most biggest unknown in our lives, which we can associate a big unknown, is death. Because everything else I can pretty much understand, but after death, I don't know what's going to happen. So in my mind as a pregnant woman for my first delivery, my mind associates the questions I have about how will I do, how will I live, how will I have a baby, will the baby be healthy, accumulated to death. So I said, do you get dreams about dying? And she said, yes. And you know how society consider dying something, something you shouldn't talk about. So she was like, yes, I do. So the husband said, yes, actually, she said, she's been asking funny questions like, suppose I die, after that, will you look after the baby? Will you get married again? And he's like, what's wrong with you? I don't understand. And when he would get upset, she would start crying. And so we actually worked on it. And thereafter, after that patient, I would often ask women by the 3rd or 4th month, especially if they said they're not sleeping well, do you get nightmares? And, the commonest nightmare that you get in pregnancy is often either falling off a cliff or sometimes of dying. And then they'll say things like, I dreamt that my baby had died. And our newspapers are so full of, death and dying and, negative sort of news that they will feel that. So, traditionally, olden days, the grandmothers would say, don't read scary books, don't watch scary movies. Probably it meant something, but right now we are so, surrounded by media that it's very difficult to be able to protect yourself from that. So this helped a lot when women realized that having nightmares about dying was perfectly normal and not a harbinger of bad news. That one patient told me that, doctor, I had this dream that I was looking for you. I was in labor and I kept calling. And they said, oh, there's no such hospital. I work at Acura. So they would say, there's no such hospital as Acura. And there's no Dr. Saldanha. I don't know who you're talking about. So, you had vanished. And I was like, no, I've come here. I know there is there. So There are so many of these things which occur in pregnancy. And when you talk about them and bring them out into the open, patient feels comfortable, and her husband or mother or sister, whoever's accompanied her, they also are able to understand her better. Like the husband will say, I told her we'll go out shopping at 7, but I got late at a meeting. I came at 9 and she was crying and there was nothing I could do. She was angry. And I didn't understand because this has happened before and she's never behaved like this. So the importance of being able to understand what your emotions are going through during pregnancy is very important. After delivery, of course, along with the pain of the stitches, of the cesarean, normal delivery, breastfeeding, if the woman says, I don't think I have enough milk, the baby's crying a lot, not getting sleep, not enough support, a lot of interference from parents and in-laws saying, you should do this, you should do that, baby's crying, baby's too thin, baby's too fat. These are really important things. I remember once when I had delivered a patient and she had a baby girl, husband and wife were very happy, breastfeeding was good. On the third morning, I came to discharge her and I found her crying, and the nurse had told me that the baby had been crying all night. So I came in, the mother had obviously been crying, the baby was asleep. The grandmother was there, the patient's mother was also there. So I said, what happened? How was the baby? She said, no, doctor, the baby's crying a lot, cried the whole night. I think the milk's not enough. Every time we try to feed the baby would push the mother. And the mother was feeling horrible, saying, is my milk tasting bad? Has something happened to my milk? So I examined, everything seemed to be fine. So then I asked, did anybody say anything yesterday? Any pain from your stitches? She said, no. So the mother looked a little, the mother of the patient looked a little. So I said, something happened. Has something happened? Could you tell me? So then she said that her aunt, that the patient's aunt, the mother's sister had come over and she looked at the baby and said, oh my God, the baby's so dark. And just that small sentence for a woman who had been doing beautifully just dropped her down. And so very often when a baby is crying, when parents tell me the baby is crying and if the baby is otherwise okay, I always ask what's happening to the mother. There was another case where there's this doctor and his wife, they had a baby, and I think about 2-3 weeks later, they called me saying baby is not drinking well. So they'd come for a lactation consultation. Things went well. They were doing very well. And then suddenly about 3 months later, I got a call from the husband in the morning saying, ma'am, yesterday, the whole night the baby cried, was not ready to feed. It was very difficult. We don't know what's happened. So I asked, is the mother okay? Any fever, passing urine, everything seemed fine. Then I said, what has changed in the house? So he said, actually, last night was the first night I did a night duty. Actually, for 3 months, I've avoided night duty. So I'm always home at night. Last night, my wife was alone with the baby and her mother at home. I wasn't there. And that's it. That's it. The mother was worried and anxious. My husband's not here. Who's going to help me? Her anxiety transferred to the baby. Baby cried. Mother was anxious. She got more anxious and it went into a cycle. He said, are you sure that's the only thing? I think pretty much sure, but why don't you stay and avoid night duties for a little longer? He did that and the baby was fine. So these are these little things which actually sort of make the difference for the patient. So that's about antenatal and postnatal. I'm not going to go into detail because it's a 2-year diploma on postnatal and antenatal health.
So, yeah, so Dr. Shaibya, I might just pitch in terms of asking some doubts. Like, so during antenatal and postpartum period, so how much do you think psychological factors or, the pre-existing mental illness factors play a role, and how much hormones have to play a role in terms of, impacting the mental health of mother?
There is no such thing as a social, cultural, emotional free pregnancy, right? Nobody just has a baby. It's like, is this the right time to have a baby? Have I been pushed into having a baby? Do I want to have this baby or not? Like, so many people got married because everybody just kept eating their brains, get married, you're so old, 28, 30, 32, 35. You get married and within a year, people are chasing you to have a baby. So it's such a pressured atmosphere. So it does have an effect because you're always worried about your body image, your health, things going wrong with the baby. Nowadays, there are more children, not that there are more children with autism or other health issues which are not detected on ultrasound, but we see it more often, we see it more common because people are talking about it. These children are not just locked up in a room in the house. They go to school, they move around, they're part of us. So we know them. So that worry comes into a woman that is there something which even with an ultrasound I may not know. And so therefore the mental issues, and as I said, labor pains, can I manage? Will I have a cesarean? Will the baby be healthy? Will I feed the baby? How will I go back to work? How will I manage? All these apparently socio-cultural things also impact a woman who is already undergoing a hormonal change in her body, which is huge, which is absolutely huge. The whole state of pregnancy is a massive hormone up and down, which comes up. And it doesn't help when the mothers and grandmothers say like, I never had any problem. I had 9 children and there was no problem. I didn't face anything. I did all my work and I washed clothes on the stone outside the house and I cooked for 20 people. Does not help. Does not help at all. So yeah.
Thank you. And so another related question that we had received from the participant is about the role of contraceptives, and do they also have some impact on mental health, or do they also flare up the already existing mental health issues?
So what they have found with the oral contraceptive pills, that the newer pills have very, very low hormonal medication. And so therefore, actually what happens with the oral contraceptive pills is instead of that hike up and down, you have a much steady lower space right through. So actually, I would say that oral contraceptive pills or cyclical hormonal tablets actually reduce the sort of menstrual cycle associated mental health issues like PMDD, which is it's an extreme example, and it will help to some extent. But we also have to understand that the periods themselves are a mentally exhausting idea. Like very few girls really enjoy having their periods. The whole concept that you have grown up and therefore you are growing towards adulthood, you're growing towards a greater space of being is not there. It's all about be careful. Now you should be like this. Now you should behave like that. And then the body image issues which are poured onto the young women and not being given time to sleep, to rest, not getting adequate food. I mean, almost 70%, there was a study done by St. John's in about 20 years ago, which said 70% of adolescents girls are either underweight or anemic. So you can imagine that girls are not given the proteins. They're meant to have 1 or 2 eggs every day or meat or fish every day because they're an excellent source of protein, or lot of dals, gram, rajma, curds, all these things, paneer. These are all foods which are very, very important for a growing child, and they don't get it. They don't get that. And large number, I would say almost about 40 to 50% of Indian adolescents come from houses where there is poverty, where your main food is rice or roti and a little dal or vegetables, but not the sort of proteins you need. Most people in India, coming especially from lower income families, are protein deficient, mineral deficient. So this itself affects them. So your periods are troublesome, then of course pain. The other thing with periods is looking at the patriarchal nature of our society, that as a woman, you suddenly get worried about being abused, about being sexually harassed. I mean, I often ask people, when you get up in the morning, what's the first thing you do? And if you look at men, they will say, oh, I stretch. And a woman says, I pull down my kurta, or I pull down my nightie, or I cover myself. And so can you imagine that the moment you wake up, the first thing you're looking at is my body uncovered or in any way, not proper. And so this is the point where I do believe that the periods sort of punish women, when actually the periods are such a fantastic level, because we do know that as long as you have your periods, and now menopause comes much later, even 48, 50, 56. As long as you have your periods, your bones are strong, your hair is thick, your teeth are protected, your heart is protected. There's so much protection that the estrogen progesterone gives to your body right through. And we don't even understand the the beauty of our cycles, the beauty of the periods. I often say that the periods are a thermometer to your life. When a woman comes to me saying my periods are irregular, they're heavy, I look at cysts, ovarian cysts and fibroids and all that, but I ask what's happening in your life. Are there stressors at home? Are there stressors at work? Are there stressors around you? What is happening? And that'll tell you, is somebody sick? Are your parents sick? Are you worried about them? Is your child not doing well? Are you having issues with your spouse, in-laws, outlaws, all these things? And they affect your periods because they affect your menstruation, and that means they affect your hormones. So there's such a huge impact of stressors on the body. So oral contraceptive pills do give a certain amount of control, which does help. However, for some people, oral contraceptive pills could, or any hormonal medication, could increase depression and migraines. So that is something you have to check. But because they take away the cyclicity and the up and down of the hormones, it does help in some of the PMS, PMDD.
Right. Thank you so much, Dr. Shaibya. So just an extension to it. So I was just wondering, like any female who's going through ART, right? Or like IVF or any kind of thing. So because for the stimulation of the ovaries, like you require a lot of these progesterone injections. So do we really need to have a check on certain kind of, mood swings or any kind of mental health issues that can crop up because of that?
I'll tell you that I personally am very against IVF, though I have patients who have had babies out of IVF and they're deeply happy about it. Because nowadays you're finding people are pushed into IVF very fast. Like they come in for a checkup and you would normally say, try so-and-so light medication for 6 months, slightly stronger injections for another 6 months, and only after that. But now this is a new story that after 30, our eggs are getting old, that Indians have a old, and that's not true. It's not that our eggs become older earlier, because all the women I know who become pregnant at 40, 42, 45 would not become pregnant. It is more about our lifestyle. Our lifestyle is so unhealthy in young people that our bodies are not able to function well. So people who are doing, say, BPO jobs, up all night, or wake till 2 o'clock in the morning, getting up at 10, just running off on a cup of coffee, cutting down on sugar, but on the other hand, not increasing their proteins, all these things, eating late at night, 11, 12 at night, all these things cause a huge effect on the body. So this fear that is created, I don't know how much this concept of fear in hospital, fear of that you won't have a baby pushes them to IVF. And IVF is so destructive for a woman's body, because a woman's body normally pops out one egg at a time. In IVF, they're giving you injections. First, they give you injections to shut down your ovaries completely. Then they give you very high injections to pop out 10, 12 eggs, which is completely abnormal for your body. Then they collect it. They give you anesthesia to collect the eggs. Then the whole process of having to put it back inside the uterus. And at least about 15 to 20% of children through IVF are having health issues. And the chance of a take-home baby is somewhere around 25 to 30%. The best centers, maybe 30. A lot of people are saying 50%, but that's because they pick up patients who are probably healthy and could have had a baby naturally if you had waited a little longer. But the family pressure prevents that, and they force them into IVF in a hurry. The family forces them, and they end up having IVF treatment when they did not. So they will conceive easily because basically the eggs and sperms were healthy. And so, yes, I believe the number of women, so if you're saying 25 to 30%, that means around 70% of women who have been through the whole IVF procedure will not get a baby to take home. And for them, the health issues attached with the feeling of failure is deeply disturbing. And so that is why I think it's very important that nowadays the good fertility centers have a counselor. They have a counselor who discuss with the family, talk to the couple, take them through the whole process of what fertility treatment is going to be like, what are the issues they may face, have somebody to talk about your fears, your anxieties. That's very, very important. And that really helps. It gives a lot of help to in fact, so many, because I don't do IVF or any fertility treatment myself personally, a lot of my patients who have gone on for IVF or who have gone on for more fertility issues, they come back to me just to talk about what's happening, how they feel, what's going on in their lives, so that, there's a sort of, that helps. It just helps to be able to talk about your fears.
Thank you so much. So we'll take a couple of questions from the chat window.
Yeah.
So Aditi, I think I'm not sure if it's for you or it's for me. Like Aditi asked, are there any circumstances where a psychologist should make a referral for gynecologist to their female patient? Any referrals that you have received from mental health professionals?
So I think it's very important that we work as a multidisciplinary team, particularly for women at different ages where they are having any gynae issues, or if they're just teenagers or menopausal. I do think that having a connect with a good gynecologist who can explain to the woman what is happening, and I'll come to that in menopause where it's really important, that a referral to gynae, in any case, we say that after 40, for example, every woman should go for a regular checkup for a breast examination, an ultrasound, pap smear, and a general health, because I think all of you are aware also, you often do B12 and vitamin D, right? Because you do know that the vitamin B deficiency does also have a sort of effect on the mind and things like that. If the minerals are not there or their food habits, sleep habits are not good, it does help. So I would suggest that women who have, but also understand that if you just send to a gynecologist who's going to give hormone tablets to stop the problem, that's not it. I think the very important thing for gynecologists, and one of the reasons why I did a diploma in counseling, was I felt that 80% of the time, for especially my female patients, the understanding of how your body works was half the battle. And to come back to that first woman I told you about with her MSc who wanted to go in her anger, we spoke about this, and then I made her do some ultrasound and other blood tests and everything to just check that everything was okay. I think she was a little anemic, and for that we had given her medication. And then I told her, why don't you come back to me after a couple of months and let me know how you're doing? Because the question of should he have a hysterectomy was still there. She came back after about 10 months and she said, my life is so much better. I understand what's happening. I'm not so angry. I've also decided to go ahead with my PhD and start the process. I told my parents, look for a guy, but I'm starting my PhD applications, admission, whichever happens first will do. And if I do get married, it'll be with the presumption that I'm going for my PhD. So that's how it's going to work. So it was so nice that just understanding how her body was working, no treatment was given, no medication other than the iron tablets was given.
Thank you. Sorry, go on.
Yeah, so that's why the referral to a gynecologist makes sense. But please, one of the worst things I've heard from most patients when they've gone to a gynecologist is lose weight. Nobody can lose weight with just exercise or diet, because weight is an emotional issue. It is only an emotional issue. It's a health issue. It is not laziness. It is not overeating. Once we get clear about that, any doctor who says something like, please lose weight, has lost the plot. This is the places where gynecologists should send their patients, where if I think my patient not losing weight, but getting fit is the issue and they are overweight or severely underweight, I would refer them to a psychologist for them to go through psychotherapy. And so many times I've seen that when a lot of the issues are settled down, automatically they're sleeping better, they're eating better, they're taking care of themselves, and the weight issue goes away. And there are a lot of people, and the classic BMI doesn't work, doesn't make sense. Everybody has a particular body weight which works for you. There are women who torture themselves, for 6 months, a year, losing those 7, 8, 10 kilos, promptly to put it back in a few years because you haven't sorted out the emotions. And that is your body weight. There is a perfect weight for your body. What is important is fitness. Can you walk? Can you run? Can you jump? Can you climb a slope without getting breathless? Do you sleep well? Is your skin clear? Do you pass stools normally? Do you have a healthy diet? All these things are important. And so I would say that those are the times as a gynecologist, I would refer a patient for psychotherapy, not say lose weight. Worst thing to say. The next question,
So what Priyanka has to ask, like some genetic test is offered for each fertilized egg of 1 lakh each. Is this really helpful?
Well, the problem is, it's not just, they do the, it's called the pre-implantation genetic study. PIGT, something like that is there. So they do, that is normally done in families where there is a health issue, or there had been a lot of miscarriages, which was found to be because of a chromosomal issue. So to check for the chromosomes, they do it. Sometimes they also do it just to be sure that after going through all this stuff, you don't end up with a baby with Down syndrome or something like that. So it's not that it's helpful, but when you're spending 5-6 lakhs, I think it's okay to do this. But understand one thing, all these things we do to that little baby, pulling out cells and doing this and keeping it chemicals and things like that, affect it. It's more the process of IVF which causes abnormalities in the baby, not just the genetic compounding. So for those who have history of abnormalities, genetic problems in the family, definitely it makes sense to do it. For the others, you can do it, but it's not a guarantee that your baby will be healthy. Would it be difficult for a mother to lactate when there is stress in the surroundings? If yes, then how does it affect? Yes, very much. As I explained, I think this question came up earlier. As I told you, breastfeeding is fraught with tiredness, exhaustion. All your hormones come down. Like, for example, postpartum blues. I remember when my son was born, my mom was stay during the night and my husband would come with food in the morning and stay the day with me. On the second day, he came in and I was just sitting on the bed with the baby on my lap and crying. And he said, what happened? I said, nothing. And I cried. So he opened the boxes and he took out some food and he put it over there and he picked up the baby. And I was just sitting and crying. And then I got a little irritated because here I was crying and he didn't seem to be bothered. He was more interested in feeding me. So I said, I'm crying. So he said, yeah, I know. So I said, aren't you asking me why I'm crying? He said, isn't this blues or something that, women said, I know you keep telling your patients that they cry for the second or third day. I'm like, yeah, it is postpartum blues, but at least you can ask me how I'm feeling, yaar. Aisa bhi nahi karo. So then he said, no, I'll give you food. That helps better. Then he patted me on my shoulder very nicely. And he said, I'll take the baby for a walk so you can eat your food in peace. But it went away. So postpartum blues is important. It helps. So stress does make a difference. How people keep telling you, and especially for a new mother, it is stressful. So a lot of times when women are told you don't have milk, it's very stressful. And that's another whole class we can take some other day. Almost all women will have no milk for 1 days. Babies are perfectly, a normal, healthy baby born at term is able to manage without any food for 1.5 days, as long as they're able to suckle. And there is no need for even a drop of outside milk, cow's milk, formula, water, glucose water, anything. But a lot of people don't know that. So they immediately within 6 hours start saying, oh, there's no milk, oh, no milk, and stress the mother out.
Thank you so much, Dr. Shaibya. So I think there are no more questions in the chat box, but more like praises for you. So, but can we move to the next segment and then we can take more questions after that?
Sure. So now I'm coming to the other end of the menopause, which is the perimenopause age, okay, which is the other part. And one of the things I must say is that my own going through both my teenage, my pregnancies and menopause has been enormously educative and a really delightful experience, so going through these ups and downs, when I understood why they were there. There's this lovely book I had read when I was maybe 40, 42 called Women's Bodies, Women's Minds, and another was called The Wisdom of Menopause. Reading about how the body changes, reading about how it affects my mind and my body made so much a difference. I remember once I was in Koramangala, I was walking down somewhere and these two women, I would say young women, because they were about 55, 56, they were both with leotards and their t-shirts and they had their yoga mats on their shoulders and they were walking down towards the club. And they said, hi, Dr. Shaibya. I'm like, hi, we're going for our yoga classes. I'm like, oh, that's great. Isn't that nice? They said, do you remember when we were 46, 48, we used to come to your clinic and just sit and cry? I'm so old. My body is getting tired. I think I'm going to die. There's something wrong with me. And we used to just sit and cry and just look at us now. We're fine, And so to understand that menopause is also a dark tunnel with light at the end. And that is just a phase that you go through, just like puberty or pregnancy and things like that, was really very beautiful. So coming first before that to perimenopause, I will talk about the periods a little bit. Like you had mentioned, how does the periods get affected? So I had this lady who was about 47 who had come to me. She was a school teacher and middle class family, South Indian. So she had come to say her periods for the last 1 year had become very heavy. Like she would have 10 days bleeding, heavy bleeding. And scan had shown a fibroid, but it was about 3-4 centimeter fibroid. And the doctors had said, I don't think that's a problem, but we can remove the uterus if you need it. Her hemoglobin had gone down to 8 or 7 grams. And she was quite worried because she was advised that, her family, and that is another thing. Family goes, what are you worried about the uterus? Now take it out. You finish with your children. Now take out your uterus. It's like, I have never heard of any man being told, oh, why do you want to worry about prostate cancer? Take off your testes. We'll operate and take off your testes because you don't need any more kids, right? So let's take off your testes. Nobody says that to men. And yet for women, the easiest answer is take out your uterus, take out your ovaries. Not realizing that they have such core functions in the body. So anyway, I took her history through and all, and then I found that she had a daughter who was 26, who had finished her master's, and she was not yet married. So I said, are you worried about her getting married? And she teared up and she said, I am very worried about it, doctor, because in our family, girls get married by 22, 23. She's 26. She's such a wonderful girl. She's so good in her studies. She's such a caring person. She's intelligent. She's beautiful. She's artistic. But doctor, she's rather dark. Like, I'm quite fair, but my husband is very dark, doctor, and she's got his color. And so, whenever proposals come, when they see her, note, write up, they're very happy. But I'm so scared to send a photograph because the moment we send the photograph, people refuse, doctor, and she's so hurt by it. And I'm so upset. I don't know what to say. So now we don't send the photograph, but ultimately we have to send the photograph, no, doctor. And so this is happening. My husband and I are very disturbed. So I said, I understand your worries. Would you have liked not to have this daughter? It's such a pain, no, to have a dark daughter. Would have been better not to have her. You would have been stressless, stress-free. She said, no, doctor, how can you say something like that? She's so wonderful. I said, no, that's not what you're telling me. You're telling me she's not wonderful. You're telling me she's dark and everything else gets clouded by that. So she said, doctor, I said, send a photograph first. Say, this is my beautiful, fabulous, attractive, fabulous daughter. If you want to even step one forward, I'm not going to tell you a bit about what she's studied, what she's done. If you don't even want to look at her, I'm sorry, you already lost your stakes. Get out of her life. We don't want you. And she said, doctor, she was staring at me. Then she said, doctor, can I bring my husband to come and talk to you? And she did actually. I had given her some tests to do and all. She came with her husband and we spoke about it in detail. And how they had become, kidnapped or, a captive of this stupidity about color. And they were literally, torturing their daughter because she felt that because she was dark and she was not getting married, her parents were sad. And the woman's period settled down in a little while. She became better. She was fine. I said, just don't worry. She'll marry when she marries, when she gets a guy who, treasures her. And please don't go look at arranged marriages because that's bullshit. So she was like, okay. But, her periods were affected. She would have ended up with a hysterectomy because all she needed was to see whether her daughter was okay and that her daughter would get married. That reassurance she needed. She didn't need a hysterectomy and she definitely didn't need tablets. So the periods get affected. So when women's periods are crazy, I often tell people that when your periods are very heavy, your uterus is crying when you are not. And then they will say, well, my mother-in-law is troubling me, or my teenage daughter is fighting with me, or my husband and I are going through stressors. We are having financial issues, all sorts of things. It can be so many things. But this happens after 40. At 35, 25, women go through so many things and their periods come as clockwork. But after 40, your periods become more, how should I say it, more sensitive to your moods. And so therefore, things which affect your mind, your mental health, and your stress also affect your periods. So now let's go to menopause. Again, there are a lot of hormone tablets are given, but I would say one thing which I must tell you is that there is a copper T called the Mirena, which is a hormone which only acts inside the uterus, doesn't act on the whole body. And for a lot of women who have had heavy periods because of other stressors, so stresses around the body, nothing to do with the fibroid or a little cyst or any of that problem, who would have ended up in a hysterectomy, at least 50 to 70% of the women avoid having a hysterectomy because they go for psychotherapy as well as they use a Mirena, which is a hormone replacement tablet, which doesn't cause hormone effects on the whole body. Now, let us look at the other thing which I would probably say is things like endometriosis. When I have young girls nowadays, I have girls as young as 25, 26 with endometriosis, which is like ovarian cysts in the ovary, which are very painful. If I have people with cysts in the breast, if I have women with health issues to do with the pelvis, I always ask them questions relating to their sexuality and their feeling of being a woman, their femininity. And these questions are, while a little difficult to ask, I always ask it in a way of saying, I'd like to ask you a few questions. Some of them are very personal, some of them are private, and they can be embarrassing to answer. And you can take a pass. So I'm going to ask you 5-6 questions about your childhood, about your health, which has an impact on your periods and on your ovaries. But if you feel that you don't want to answer it, whether it's a yes or no, it doesn't matter. But if you say no, then you just say pass. That means I don't want to answer this question. I don't feel like answering the question, and we'll just go ahead. And well, most patients do ask. So the questions I ask them are, when you were born, were you welcome? Was there a welcome, or were you the third daughter or the fourth daughter? Was everybody expecting a son? So this gender issue is there. I asked them that, was there either of your parents suffered from depression or anger? And I was reading, actually, while I asked about sexual abuse, I was reading recently that having a parent with a lot of anger issues is often like having a parent who is alcohol dependent, because you never know how they'll behave. They can be very sweet, very kind, and instantly change. And this sort of an anxiety, or this sort of the fear, a child comes home from school every day and you open the door and you don't know whether you're going to have an angel or a monster in the house. The sort of anxiety that creates impacts your growing up years. I don't have much experience of male patients, so I don't know how this would impact them. Many of you would, but definitely in women, it impacts your ovaries and your breasts. Of course, neglect, a lot of physical abuse, being beaten by the parents. I have women who have gone through and developed a thyroid and other issues, diabetes at 25, 26, with parents who used to beat them a lot, physically abuse them a lot. Emotional abuse, comparison with siblings, having a sibling who is very beautiful in the traditional socio-cultural manner, who was better at school, better at work, or death of a sibling. These are all questions I would ask when a woman comes to me saying her periods are irregular or she's having health issues. I remember my sister, she's a psychotherapist herself, and she was doing this family constellation. And we were talking about, mom and all of us and all. And I said, and she was talking about, how many children and this. And I said, that mom had lost a baby when she was 7 months, when conceived, before I'm the eldest, so before me. She said, no, I didn't know that. And my mom had lost a baby at 6 or 7 months, and she had never spoken about it. I think I learned about it from one of my aunts. And when I asked my mom, she just said yes, very late, when I was about 40, 45. And my sister didn't even know about it. And it was never spoken about. So one of the things that happens is a miscarriage, or losing a baby, or having an abortion, is also a huge stress for a lot of women, because we're not allowed to speak about it. So to be able to, again, that's about a failure. You didn't do your good job. So having a miscarriage is about failing. And so that also becomes something that women hide, and it causes a lot of stress in marriages, particularly women who have had a termination of pregnancy before they got married or in the early married years when they weren't ready for a baby. The terror that they are now going to be punished by not having a pregnancy is very strong. So when couples come to me about fertility, I ask, have you had an abortion at any time? And you do know that your MTP does not impact your ability to have a baby, and that having a baby at the wrong time is as bad for both you and the baby as, and at that time, a termination is a good idea. And almost 95% of women who have gone for a termination when they wanted it have been deeply relieved and emotionally happy after having had the termination. Again, it's the socio-cultural pressures of having a baby later which bring it up. At that moment of time, they're really relieved. So that's for the perimenopause. Now let's look at the menopause, what's happening over here. If a woman is at 40, 42, the hormones start sort of, so what's happening at 40, 42 is that you're not near menopause, but your eggs are getting older. So when you were younger, the hormone would jump up and your egg would pop out. The hormone would jump up and the egg would pop out. Now those eggs are these old eggs who are a little stubborn. So the hormone has to go higher for the egg to come out. And so all your hormone levels are going up higher in the cycle. So instead of a normal lighter cycle, they go up and down, up and down, up and down. And so your emotional issues become more. Again, as I said, the emotional issues before your periods are very troublesome and they become more in your face. And so women who have a lot of care, so they have to take care of their children, their spouse maybe, and they have to take care of parents. A lot of women who are single, either because they have stayed single, never married, or they married and divorced or separated, widowed, are now staying with their parents to take care of the parents. It's a huge stress to be a caregiver to parents because parents are sometimes clingy, they are demanding, and they expect a young woman, a single woman, to follow the rules which they followed when she was 20, 22. Come back at this time. Why are you going out with your friends? Lack of freedom. All this causes a lot of issue. So one of the things for single women when they go through 40, and some women who are very, very happy not being married, there was a choice they made not to get married. They're very happy with their single state. Either they're working or they're involved in, very many pursuits. They do really well. But for women where there is this stress of, I was not married or I've gone through divorce, I'm separated, these affect the health a lot and they cause a lot of issues with their periods and general. So I do go into it a lot in detail. This is for single women. Now for married women. Around 40, 42, and this is very interesting if I ask any of you this question, what would be better for the species? For one woman to have 4 children with one partner or 4 children with 4 partners? One child with each partner. Which would be better? Anybody?
4 children with 4 partners.
Exactly, right? But we are so brainwashed with the whole concept of monogamy and things like that. But also there's a payoff. If you have 4 children with one partner, that partner is also invested in taking care of them. So he can pay their school fees and college fees and drop them and pick them up and stuff like that. So it works. But your body doesn't know that. And at 40, 42, when your eggs are sort of like the last few eggs are coming out, the body's like, hey, your eggs are going. Please use them up fast. Don't waste these eggs. And suddenly women have these spikes of sexual desire after 40, 42, and it's not with the husband. The husband is very boring. And a lot of women end up saying, don't touch me. And the guy's like, I didn't do anything. My hand just came that way of the bed. And she's like, no, I like to sleep on my own. So women suddenly at 40, 42 say, I like to sleep on my own. And they love their husbands dearly. They're like, I love my husband. He's great, but I do not want to sleep next to him. I can't stand him. He snores. He farts. He irritates me. And the husband is like, I've always snorted and farted all my life. This is nothing new. And so women are more expressive. they also become more like, intolerant. And there is a lot of, not lot, but there is an attraction to other men. Like they're like, oh, that handsome gym trainer, or that handsome so-and-so, how exciting. And when I say that, yeah, you are sexually attracted to many other men, they're like, yes. I mean, you're not even allowed to think things like that, because this is like social ostracization. But it's normal. What you do with your feelings will have consequences, and that you have to decide. Nobody can talk about that for you. But the feelings are very normal, completely healthy, and it's your body's biology saying, don't waste your eggs. That's all it means. And there's nothing wrong with it. Feeling attracted, feeling sexual, feeling different, not wanting to sleep next to your husband. Suddenly, all these years, you wanted a fan, the husband didn't want a fan. Now you're like, no, I want the fan. If you don't like it, I'll sleep in the other room, or you sleep in the other room, you sleep in the hall, you sleep in the sofa. It happens. So it's very nice for men also to come in. And a lot of women with whom I've spoken about menopause have come in later and told me, can you tell my husband all this? Because he doesn't understand why I don't want to have sex. Sexual drive is zero sometimes. It's underground. And the guy is like, doesn't understand why. He's like, why aren't you wanting to have sex? Are you not attracted to me? And she's like, no, I love you truly. I do not want to have sex with you. And the sexual desire is zero. And that's also very normal and common. There's nothing wrong with it. The presumption, again, the socio-cultural concept that a woman has to have sex to keep her marriage going, that she has to have sex whenever the husband demands. These are things that we have to sort of break down for women. That is not true. And you ask a woman, there were times you wanted to have sex when you were 30, 35, your husband was very busy, he said, I'm too tired, I don't want to have sex. You didn't throw a tantrum, you didn't threaten that you'll go off to your neighbor. So why do you presume he will do that? He can also be understanding if you explain to him the things. So this is what happens. Now, the other things in menopause, one is, of course, the sexual desire, which goes all over the place. Menopause is like a breakdown of the body where your reproductive system is dying. You could say that. But in human beings, even after our reproductive system goes down, we have a lot to give to society. So, for example, there's the grandmother theory that the reason grandmothers still survive is because the grandmothers had more knowledge about taking care of babies, so they would help the young mother. So in human beings, particularly, as with say elephants, the elephant herd is led by the grandmother elephant. She does not have kids of her own. She is beyond reproduction, but she has the wisdom and knowledge to be able to guide the younger ones. So the same way this happens, but in menopause, it is a way of the death of the reproductive system. And so, as far as the body is concerned, as these hormones, after having gone up this high speed and now coming down, there is muscle stiffness, joint pain, a lot of digestion issues, like your gassy feeling, you feel, I can't eat food. If you eat something slightly off, little oily, little acidic, your stomach gets upset, you go to the bathroom 2-3 times, you start farting. You remember the times when your grandmother would fart and you would be like so shocked, like, how can you do this? And then suddenly now at 45, 50, you're going farting around the house and everyone's looking at you like, Mom, what's happening? And it's just a normal system of the body because of the hormones. A lot of swelling of the feet, bloating, water retention, face swells up, you feel like a pumpkin at times. Sleep gets disturbed because your hormones, when they go up and down, the sleep goes for a toss. So sometimes you're not able to sleep, though you're tired. Fine, you sleep at 3 o'clock, you have to get up in the morning by 6, 7. Other times, you're very tired, you go to bed by 9:30, 10, and then 3 o'clock in the morning, you get up and you're like an owl, you can't go back to sleep. And that is why it's very important for women to be able to get good sleep for the time of menopause, which is around between 45, 55. For some women, it can be as early as 42. For some women, it may go on to 58, 59, and is all normal. As long as you do your tests every year or every 2 years, and you're doing well, you exercise, you're fit, you eat well, and sleep. Sometimes you may need 8 or 9 hours of sleep. So if your night sleep is disturbed, please sleep in the afternoon. It'll make a huge difference. The other thing which is in pregnancy, your tears, crying very easily, that would happen, feeling fatigued. And then again, thoughts of dying. So women at 48, 50, their children have gone to college and they're like, oh, they're going to die. Something's going to happen. And it's not just dying or getting hit by a bus. It's like tomato sauce.
And everybody's like, I shouldn't even think like this. Why do I think? Husband has come late by half an hour. You're quite sure he's had an accident and he's dead. Everything, Also at about 50s, your age is when you are hearing of deaths. Parents are dying, your friends' parents are dying, uncles, aunts. And now for a lot of people, even their contemporaries, from cancers, from heart attacks, post-COVID especially, it's a little more than earlier. These things are causing anxiety about death. And it does happen. This is a dark tunnel and you will go out into the sunlight on the other side. So these are physical symptoms, the mental health symptoms. Here in this case, I often ask the husbands to come in. I talk to them about this. They don't feel like having sex. They may want to be cuddled or they may not want to be touched. For a woman at this age, just being at home and, not doing anything at all is perfect. Oh, children have to go out. Husband has to leave. Please, please go, 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 go. I just want to be at home alone without anybody. Hate doing cooking, get up in the morning feeling bleh. And the commonest thing is they say is that, what would you like for food? She'll ask the kids or the husband, and everybody is very cautious because now she keeps blowing up at the drop of her hat. So they're like, make whatever you want. And she's like, don't tell me all that. I don't know what to make. You will tell me what you want me to make and I will make that. And they're like, you can't have a right answer. Anything you say, she's going to blow up. So this is important. However, again, at least about 10 to 15% of women during menopause will require antidepressants. And very often, I personally do the Beck's depression inventory or the anxiety inventory. And if I find the scoring is on the slightly higher side, I refer them to a psychologist just for psychotherapy to discuss. And sometimes for women who tend to cry a lot, who are not taking care of themselves, they do need antidepressants, which help. And I always tell them, because this whole fear of antidepressants, I will get hooked onto it or I'll never get off. And I tell them this is because of your hormones and you will be able to get off it, but it's important to take care of yourself. And you may need to take it for maybe 6 months, a year or 2 years till your hormones settle down. That will be really important. I think I'll finish now. I've taken so much time. Go ahead.
Thank you so much, Dr. Shaibya. We were quite hooked with what you were speaking about, right? So we'll take some questions which are there in the chat window. So Nandini is asking, is it normal to feel bloated near the belly, literally whole body? And I feel bloated, including my face. I feel I look very different few days before getting periods. And I think she's 47 years.
So here I would say, Nandini, I think it's very, very perfect to feel bloated. And actually for a lot of my patients who are between 45 and 55, whose periods are sort of getting over, and a lot of them have put on weight during COVID because we were stuck at home, no exercise and all. And when they say, I feel so bloated, I'm heavy, I put on weight, especially the stomach bloats. You have this equator just going off. No matter that you're eating less, you will actually be eating less because you sometimes eat lunch and you feel so stuffed, you don't feel like having dinner, but your stomach is bloated. I always say that I'm much happier that you've put on weight than you've lost, because frankly speaking, losing weight at this point of time is always a worry about cancer. So unless you have doing a determined diet and exercise and being fit, and therefore you've lost weight, I'm quite happy if you've put on a little weight. All this bloatedness will go down. And immediately after your periods, you find the difference. Like people whose jeans didn't fit, a 2-inch gap, it clips. Your bra feels tight, your underwear feels, too tight. And just after your periods, you feel much better. Everything fits well. That's normal. It's cyclical. It'll go away when the periods stop.
Right. So we'll open the discussion for other participants as well.
Sure.
Yeah. Thank you, Sadhana, for joining us. So any questions, anything that you would like to ask?
Maybe you take me off the spotlight and bring me.
Yeah, sure.
No, I mean, I don't have a problem with the spotlight. I enjoy the spotlight very late in life. I was always terrified of standing on the stage and stuff like that. I've just gone better now.
Yeah. Right.
But
so
yeah,
I think I missed one question from the chat window. So one of the participants had asked that if cannabis or marijuana has some impact, on mood issues or during the periods.
No, weed doesn't have. So, well, I have a lot of young people in my life who are into weed. I have my concerns about anything which is hook, which can have a potential effect of that the pre-period discomfort goes away with weed. A lot of post-operative pain reduces with weed. But the point is, we don't know how to regulate it. Unless there was a way of regulating it, I'm not so sure that I would ever advise it to anybody. But what I'd also say is that it won't have any effect on future pregnancy. Having weed, alcohol, being a complete idiot when you were a teenager does not affect your health when you are, if you're now healthy. If you were smoking, it takes about 4 to 5 years for smoke to get out of your system, whether you're a male or a female. So it would be good to stop smoking, start exercising, live healthy. But having weed in your younger age will not affect you in terms of pregnancy.
Right. So thank you. So one thing that you just mentioned, right, like during period. So I was just seeing a client recently because she takes cannabis as a way of, reducing cramps and pain during her period. So is it advisable, or should we be worried about, talking about it?
So officially, none of us can say it's okay to have weed for your dysmenorrhea. But I would say if you look at how brufen and ibuprofen and diclofenac kills your kidneys, kills your liver, I'm really wondering, right? Because now in the US, they are allowing marijuana for medical reasons, and it is much less harmful to the body in the studies that have come. It is much less harmful to your kidneys and your liver, again, within limits, right? Just like you would not take 10 tablets of crocin, it would be advisable not to smoke a lot. And because we don't have too much studies on it, we don't know what is the exact level, how much should you smoke, how much can you take, these are the issues. CBD oil is given to a lot of older people with trigeminal neuralgias and things, and it's much better than some of the medicines that allopathy has to give. Yeah. Any other questions?
Any questions? I think Kapil.
Go ahead.
Hey, ma'am. It was a really nice session. Thank you for this. I'm Kapil. I'm part of Green Oak. My question is regarding hygiene, or a way, because we see a lot of women who come in who have PMS and difficulties with mood regulation during, just before the period, during the menstruation also. So just wanted to understand if there are some tips that we can provide them with how to manage it before and during, so that they don't have as much distress as they usually go through.
So very often I suggest 2-3 days of rolling yourself up in your blanket and staying at home, like Amazon and some of the other companies are actually giving period leave, and there is a backlash from some women and a lot of men saying that why should women be pampered during their periods? My point is, if you don't pamper women their periods, they're going to take off tablets and take off their uteruses, and then you're never going to have any more babies anywhere in the world. So I think women deserve to be pampered. So having a massage, body massage is really very good. Hot bath soaks. Food which you enjoy, this whole thing of, I eat so much chocolate and I eat so many sweets and I crave sugars. Hello, your body wants it, take it. But the point is, don't feel guilty. Don't eat that whole, 20 these things of, laddus, a whole box of laddu, fill it and then feel guilty about it. Enjoy it. And after your periods are over and you're feeling fit and fine, go exercise it off, go walk to Savandurga, do a trek, run in Cubbon Park, do whatever you want. But never feel guilty about having those laddus. So I think one of the biggest issues we need to do is get off this guilt trip about pampering ourselves, taking care of ourselves. Go meet a friend, go out with a friend, and meet a friend meaning pajama party. Not where you have to dress up, where your clothes are tight. Just sit at home, have a glass of wine, Yeah. Really taking care of yourself. Yeah.
Priyanka, I'll just get back to you. So I'll just address one question which has come on the chat box. Like we were talking about the weeds. So if there's a continuous use for 15 continuous years, a couple has consumed weed. So will that have an impact on pregnancy?
No, not at all. The only thing is there will be tests being done, to check the husband's sperm count and the woman's eggs and if her cycles are regular and she's otherwise healthy, no thyroid, no blood sugar, which weed, of course, does not impact. She's basically a healthy human being. And same with men.
It is smoke which actually damages smoke, and all the cigarette smoke which actually damages the sperm, which can cause a problem with fertility. But as far as weed is concerned, there is no, no scientific research which shows that weed affects fertility in any way.
Thank you, ma'am. Priyanka?
Hi, Dr. Shaibya. This was a wonderful, wonderful session. Thank you so much. Just one line I've been hearing a lot from adolescents lately, or even like actually women in their 20s, is too tired to exercise. So whenever exercise is suggested, even as part of psychotherapy or something, there seems to be this tiredness that a lot of them are feeling. I don't know if that's a general thing that's happening right now, or what have you seen? Like, just wanted to understand that better.
Yeah, so normally when I would like young people or anyone to exercise, because that does release endorphins and it is helpful, I normally tell them, I want you to do some movement. What would you like to do? And I don't suggest anything till they come back. They may say dance, they may say going for walks with friends. You know, one of the things teenagers can't stand is parents in their lives. They really want anybody but parents. So telling them to go out for a walk with friends, that's really so good, because they walk for miles sometimes, just chatting away and talking to friends. That helps. So actually starting to push them towards it, and it makes a difference. I have so many of my friends' children who say, Auntie, my periods are so irregular, but you know what, in April, May, when there are holidays, I'm going for tennis every day or swimming every day, and my periods are perfect. I feel good, I feel fit, and I see that. So I normally don't use the word exercise because it's a very, traumatic word. I tell them physical movement. What would you like to do for movement? And you could stand and do painting or drawing, or even if you're using a musical instrument, like playing the guitar or playing the harmonium or the piano, all that has physical activity. It stimulates the mind, stimulates the brain. Or I tell them, go for a gardening class, something that you would like. So I just leave it to them to tell me what they would like to do. And most of them would like to, it's just that so often they're told by parents, get off the seat, get out over here. And again, not exercising or not moving has to do a lot with the mental anxiety. So sometimes for them, if they require antidepressants or medication at this time, I would also check their vitamin B12 and vitamin D levels. But this would make a difference, and then help them to do something they would like. That's important.
Right, Dr. Shaibya. So there are a couple of direct messages that we had. Like one person is just trying to clarify again that what are your comments on nicotine use and pregnancy? Just to clarify that if nicotine-free time of 4 to 5 years is preferable.
Yes, nicotine is harmful. It's actually not just the nicotine alone, which can cause abnormalities in the baby. It's also the tar and all the other ingredients which are part of the filter and the paper and the way the tobacco is, and we're not talking of weed, we're talking of tobacco. The way the tobacco is processed has a lot of carcinogens. So therefore, getting rid of the nicotine, and nicotine itself damages sperm count. It damages the motility of sperm. So that's why within 5 years of stopping smoking, your body is completely back to normal. But even if you stop smoking last month and trying to become pregnant within another 3 months, it's good.
Thank you. And another question is like, can hysterectomy around 50s aggravate or probably precipitate depression?
No. In fact, sadly enough, I have had people in my own family saying, hey, I got my plumbing removed. I'm like, plumbing removed? What do you mean by that? And they're like, no, I had a hysterectomy. And I'm like, it's not plumbing, man. How can you call it like? So, there's so many are like, oh, I got rid of my uterus. I'm done. And so many times I have patients where I have said, no, you don't need a hysterectomy, but they are determined to have a hysterectomy. And this is again, it's like this, I hate my uterus. It's kept me captive. It's spoiled my life. I've had to produce babies. I can't go into the temple. I have so many restrictions. And that is very much an Indian concept of the notions of restriction which are put on women so that they do have hysterectomies. But a hysterectomy per se does not cause depression. I would probably say that the reason the woman had a hysterectomy, which could have been many other heavy bleeding or stomach pain, was already there because of emotional, social, cultural issues which had already hit her. And removing the uterus now takes away the actual pain
or the bleeding issue, and now you have the mental health issues to face because the problem didn't go away just because the uterus was taken out. As I said, the uterus cries when you don't cry, and then taking out the uterus cuts away that crying. So then you end up with the mental health available. And there are some women who have very severe depression. And there was a very sad case of a woman, severe depression around the age of 50, 55, went to many psychiatrists, many people. Somebody had called me, a friend who's a psychiatrist called me and said, what do you have? And they tried to give her hormone tablets, HRT, she would vomit. They gave her antidepressants, she vomited. SSRIs, everything they tried. They tried so many different medication. She would just start vomiting. She would faint. She would become unconscious. And finally, she committed suicide. And, the psychiatrist, the friend of mine who was speaking to me, they were so upset because we could all make out there was an issue and nothing we seem to be doing. And good husband, very caring, 2 sons, doing well in college, working. There didn't seem to be anything obvious which could affect her, but there was a deep-seated issue and we could not put a finger on it. And there was no treatment that she could take. Later on, when I asked my sister about this, she said ECT might have helped for extremely this thing. So I'm now going into your area, so I won't go further, but this is what I learned and something I would like to share with you as a possible option.
Right.
I'll just 2 more questions.
Yes.
Transdermal estrogen safe to use in peri and postmenopausal Asian women for mood symptoms? Yes. Immediately after menopause or after hysterectomy, where the ovaries are removed, if there is very severe depression or night sweats and all, and you have tried psychotherapy, you've tried all the other treatment like massages. I find a massage every week, vitamin tablets, some sort of, change in environment really helps. But if not, transdermal estrogens work well. You can start with a good dose and you can continue it for about 6 months to a year and then taper it off. It's not harmful.
Right. Right. So I guess we are almost reaching our time, and on behalf of the Green Oak Initiative, thank you so much, Dr. Shaibya, to be part of our expert talks. We thoroughly enjoyed it. I think you kept us hooked throughout these 2 hours, and it was quite an insightful and informative session. Looking forward to more such sessions with you. And thank you all the participants to being a part of this afternoon with us. And we shall see you next month. Thank you, Dr. Shaibya.
Thank you so much.
Right. Thank you.
Being so interactive.
Thank you so much.
Bye.